Thousands of women rely on Botox to erase years from their face. And despite the economy, the American Society of Plastic Surgeons reports injections are up 8%. But now there is a brand new competitor on the market. Health anchor Alicia Booth found the first doctor in Northeast Ohio to get it, and he found 4 volunteers to put the new Botox to the test.
I like it.
The pressure to be beautiful is everywhere, but these days just looking good isn't good enough. You have to look younger too. Plastic surgeons say Botox is the #1 non-surgical cosmetic procedure in the country, and until now it's been the only game in town.
So if we can have more choices, potentially lower costs to our patients, and allow more people to get Botox or similar products, I think we're going to have more happy patients.
Dysport just got FDA approval for cosmetic use, and Beachwood plastic surgeon Steve Goldman is the first doctor in Northeast Ohio to get it. Eager to learn more about the botulinum-based injection, he invited 4 of his patients to try Dysport at no cost to them. Judy Friedline, Gina Friesel, Grace Brown, and Christina Turton have all tried Botox and liked it, but can't wait to try its new competitor.
To be able to feel good about myself when I look in the mirror.
I'd like to see if it lasts longer. I don't really want to change my appearance too much. I just want to be the best version of me.
And since Dysport will be sold to doctors at about 15% less than Botox, our volunteers are hoping Dysport's going to be more affordable.
That was the ultimate encouragement of me wanting to do this, is to try to keep costs down.
So one by one, Dr. Goldman injected the Dysport and took the volunteers before pictures, with everyone anxious to see what happens. 19 days later, the 4 women returned for their after pictures. With differences often very subtle, the best way to compare the before and after shots is to have them wrinkle their forehead.
Okay, now try to scowl for me.
I can't.
Like the other women, Christina says the Dysport worked just like Botox, but kicked in a couple days faster.
I felt the difference the very next day, within 24 hours.
Grace isn't sure which injectable she likes better and will probably let Dr. Goldman pick next time.
Painless, looks nice, can't scowl, so I'm happy.
Gina says she likes the Dysport better.
I think when I watched Dr. Goldman inject it, he just put a little bit between the brows, but I noticed almost all the way up my forehead. I don't have any wrinkling, so it seems like it got a little better coverage.
Dr. Goldman says he's encouraged by the results.
It's a small sampling, but none of the patients had any problems, and they all liked the fact that it had a quick onset. So that's going to be useful for some patients.
And what the patients in our experiment find useful is knowing there's another effective choice out there. And Judy speaks for the group when she says there is one big potential tiebreaker.
I would probably go with the one that is least expensive.
Now, there's no guarantee doctors will be passing that savings along to their patients. It's an individual decision. But there is every possibility that the competition may even force the price of Botox down a bit. We'll see. Right now, the average price ranges from about $300 to $600, depending on how much you get. By the way, Pure Tox, a third competitor, will be coming to foreheads near you soon, probably in the spring. For News Channel 5, I'm health anchor Alicia Booth.